It's a matter of great happiness for those of us who are parents to bring their children into the world. We try to shield them from every trouble with all our might. We can't accept their most insignificant inconvenience. Our newly born children become inseparable from our existence. Our lives start revolving around them. But very often, we fail to understand the state of their minds while bringing them up. We tend to look at our children solely through our prisms, from our points of view. As a result, despite our efforts, we fail to comprehend them. Sometimes we do not even try. It's perfectly natural for babies to suffer from separation anxiety through the first 7 to 18 months of their life, but after 18 months, it usually starts fading away. What is separation anxiety in the first place? From the first 7 to 8 months, a baby begins to actively seek a safe shelter, safe people, home, and environment. The infants look for this safety in their parents and grandparents. They zero in on single individuals. They become attached to those people. They can't stay away from those particular caregivers, even for a moment. The infants cling on to them even when they are sleeping. No matter what they do, feed, sleep, play, take a bath, or go for a stroll, the caregivers have to be around. But we should be concerned if this practice doesn't begin to wear off even after 18 months. This could be harmful to the children and prove detrimental to their healthy mental growth. A survey conducted in the United States reveals that 4 to 5% of children in the 7 to 11 age band suffer from separation anxiety. Significantly, only about 1.3% of the teenagers who took part in the survey were found to suffer from it. How can we identify the symptoms of this mental problem? 1. The children refuse to step out of the home. 2. They insist that the person whom they are particularly attached to always stays with them at home. 3. They are always worried that they might lose their caregiver. If those individuals leave the home, the children start worrying that they might not return ever again, or else they harbor fear about being separated from their caregivers for good. 4. They refuse to go to school. 5. They are unwilling to interact with anyone. 6. They always keep whining about something or the other, always remain irritable. 7. They always worry about the safety of either their own or that of their favorite family members, could even have fears of death. According to experts, separation anxiety could happen due to environmental and biological factors. Chemicals like serotonin and norepinephrine produced in the brain could also trigger this. It could be induced by any traumatic event or fear of any family member. Please seek the help of therapists immediately if you notice your child exhibiting such symptoms. This mental issue could snowball into an extremely serious problem if it's not addressed at the beginning. Cognitive behavior therapy could play a very effective role in treating this condition. It is also very important for us to be keenly aware of this issue. The future of your children can be bright only if they remain physically and psychologically healthy. Such a mental illness could also be transmitted genetically. If there are histories of depression, phobia, anxiety, or alcoholism in the family, then the child could develop such ailments. More often than not, by the time the patients are brought to the therapist, it's already too late. This happens because most of the time we do not give mental issues as much importance as they deserve. Most of us so unwilling to accept the fact that mental problems require suggestions and interventions from doctors as much as our physiological problems do. So, if you notice such mental problems in your child, please contact us. The earlier the problem is diagnosed and treated, the better for both the child and her parents.